All right, episode three, the Nothing Stronger show. Today we are talking about Jacob's experience with Jen during his rehab process at Nothing Stronger. So a lot of people don't know this, but before Jacob started, we jumped on a phone call and talked about his experience in physical therapy and what Nothing Stronger was doing and what our mission is doing. And he was really interested in the gym, but as well as what Jen does. So I remember I was walking in my backyard. I think we must have talked for over an hour, maybe an hour and a half about physical therapy, about sports medicine, private practice, small group personal training. And I could tell he was very interested. We started our relationship off by getting him into Jen, getting the evaluation done, and then he started shadowing our sessions. And next thing you know, he's full-time, nothing stronger. Jen and I could have been more pleased and proud of the progress that he's made, but he also has a story to share because he was a patient of Jen's. And his story is one
Momentarily.
that I think of, well, not necessarily, but I mean, he was coming here to get pain relief, which is what people do. So let's start with Jacob's pain story, and then we'll dive into what Jen found with the evaluation. So let's take it away,
Yeah,
Jacob.
yeah. So I came here. I mean, originally because obviously I was really interested in what you guys were doing, especially on the training side, but also the rehab side, and especially kind of marrying the two together, which I think is very important in terms of staying healthy, staying pain free, and I think it works a lot better than just going to PT or just going to training, and having a little bit of like overlap between the two, I think is beneficial. But for me, I originally came in with some right shoulder pain. For me, it was diagnosed as like shoulder tendonitis by my PCP. That being said, I think everybody has an experience with that where their PCP just kind of takes a look and writes a script and doesn't even really look at it. So when I came into Jen kind of took a look at how I was standing, how I was moving, took some pictures that really kind of teased out like the imbalances and shifts between like my pelvis and my rib cage. And I think the biggest thing that I learned from that is that it wasn't necessarily the shoulder that was the issue. It was patterning of how I moved that was more of which was causing those symptoms. And I think it's a complex thing and it's something that I've thought a lot about. I think everybody goes through the process of being like, what did I do wrong to get tendonitis? What did I do wrong to get this injury? When reality is it's not really your fault at all. It's kind of the world you live in and how you interact with it. And sometimes having a third perspective of, hey, check this out. This is how you're moving, or this is how you're walking. This is how you do things. It can be really eye opening in the sense of like, I mean, I had no idea I wasn't neutral. I thought I was neutral my whole life. So just getting these exercises and getting kind of that third perspective was really beneficial for me. And it turned into like, I mean, if you look at the exercises I do on a daily basis, it's much more kind of diaphragm, pelvis, and rib cage kind of orientation related. Not so much, just strict external rotation of the shoulder, range of motion of the shoulder. That being said, I don't think those are bad things at all. I think those you should be working on those things as well. But I think it's almost like a kind of a hidden underlying perspective of how you're moving overall that really makes a bigger difference in those kind of smaller injuries. But so for me, like a couple things that I guess that I found that I needed to address were one, how I carried stress in my body and how that my daily activities were affecting that. So for me, this kind of shoulder pain slash back pain really got worse after college. And when I started doing a lot more driving, had a full-time job, first couple years out of college in my first time full-time job. So I was, figuring out, I guess my life. And part of that was just the stress that I was carrying in my neck and my shoulders. And again, how it affected the way I was interacting with the world and how I was moving. But I spent a year trying to figure it out. I was pretty frustrated with how I was feeling, especially being limited in my physical activity and going to the gym and not having the confidence to go into the gym after work, feeling like this might just screw up my back for the rest of the week, things like that. So, another thing that was really beneficial for me was training with Tim and getting these modifications and learning how to work around these injuries. Because I do think a huge part of the recovery process is keeping yourself moving and keeping yourself healthy. And I was just talking about this with Tim earlier, where I do think that having a healthy base that you can kind of recover from, or have healthy like base of health, allows you to get better outcomes later on, as opposed to just focusing on your rehab and then getting into the strengthening and the conditioning and the kind of healthy habits, and then assuming that you'll never have to go back to that injury, or you'll never have to revisit those exercises. I think it's a big thing that I learned was that you should keep yourself moving, keep exercising, but add these kind of supplemental exercises in order to prove your mechanics, in order to prove the way you move. But the big thing is don't stop moving, because that kind of, it slows everything down, in my opinion.
I think I think that's one thing that a lot of people can relate to is that they get injured and everything becomes like a silo, like Jen talks about. Like, oh, now you have to like only do this or I can't do this. Like it becomes just a list of like no's and can't do's, which affects us mentally, affects us posture wise. Like it just goes down this list um that we just don't want to go down. And people tend to categorize things too easily instead of thinking of body like a whole, which I know Jen touches upon with her silo talk and everything like that. But is there anything you could touch upon with this?
I have so many things I want to say, and I'm trying to organize them in my brain based off of what Jacob was saying. But I think Jacob is the perfect example of, you look at somebody and they look like they're in, awesome shape and everything is symmetrical. And, they've taken into account a lot of the large structural kind of foundations. Obviously, he's an athletic individual playing hockey and, exercising and working in a physical therapy clinic. And so you would almost think like he has the perfect form, right? And he should be pain free, right? But on top of hockey, on top of stress, on top of his, workload, on top of school and everything, he also was, is a fly fisher. And so that innately kind of comes into this whole conversation too of what happened and where did it go wrong, right? And for the clinician, sometimes it's helpful to know that, right? And sometimes it doesn't really matter when it went wrong or when the patient felt like it went wrong. Most of the time, Jacob kind of alluded to this. It's like this foundational programming that gets put into this weave within our body, right? Into our fascial system, into our soft tissue. So it's not necessarily got into, I started exercising 3 weeks ago and now my shoulder hurts or something like that, right? Most of the time, these compensation patterns are so rooted into the foundation in the network of how our soft tissues work and operate that it's not always this one-time thing that happened, right? You should be able to theoretically go and run a marathon, right, without getting injured, or pitch innings in a game and not get injured. But for some reason, there are these faulty mechanics that start to interweave into our everyday lifestyle. And then that's when, a lot of these injuries start to come about. And for Jacob, it was really just sort of fine tuning some of these areas that were problematic, right? And Jacob kind of said, we looked at pictures and to try to find what my neutral was, right? We're all a little weird, right? We're all a little different. Our bodies are not supposed to be these robots, and we're not supposed to be this uniform thing, symmetrical on both sides and in every aspect. And the problem comes when you fall outside of those boundary lines. And what is that boundary line? Researchers and movement therapists and manual therapists are still trying to figure out what exactly is that boundary line, if that exists for any individuals all over. But for us, it's really figuring out how those, alterations within the foundation of his shoulder and his core and his hips and everything, and how that translated into how he carried himself in everyday life, right? And so when we were looking at the shoulder specifically for Jacob, it all came back down to his rib cage and his pelvis. I could probably talk about any injury and you'd be like, okay, of course she's going to come back to the pelvis and the rib cage. And that's because that's where everything kind of stems from. If you're not fixing the root of the root, then you're just kind of slapping a Band-Aid over it, right? The shoulder can't be in the most optimal position, or the elbow or the hand, if everything up the chain, cervical spine, thoracic spine, lumbar spine, pelvic area is not in proper positioning within that boundary segment. So for him, it was really focusing on, like he said, the diaphragm and resetting like that lower core, the pelvic, and then how that translates to him moving in time and space with his shoulder. So if you just start to focus on the shoulder, like Tim and Jacob were saying, if you just focus on the shoulder, you're only going to get so far if you don't fix the foundation for that. And for some people, just slapping a Band-Aid on it is okay. And so that's why some PT programs will work, right? Where you're just focusing on that segment that's injured. But if you want that long lasting optimal optimization of everything, you really have to kind of start to weave back into the why behind the why. And oftentimes that comes from, the rib cage and the pelvis.
Jacob, what
Absolutely.
did your warm up? I know you incorporate a lot of what you've learned with Jen into your current warm up when you train here. So, what
Absolutely.
did your warm up look like? What did it look like before you worked with Jen, and then what did it look like after you worked with Jen?
So I would definitely characterize it as I was very focused on, I guess, extremities and whatnot. So I was always stretching, shoulders, hips, knees, hamstrings, quads, those things. But I never, again, like what Jen was talking about, is that foundation of like the pelvis and the ribs and the positioning. And I never addressed that. And to be fair, I never really knew I had to address that, right? People would always say, you should have a strong core, you should strengthen your core, right? So that's what I always did, but no one ever taught you how to, like, what was this neutral core, and how are you going to strengthen it, and what does that look like? That was never really, explained to me. And I think for a lot of people, it's not something that's like, common knowledge. It's not something that you should know, but it is something that you should learn, I think. And for me, what that looks like is a lot of breathing drills, 90-90, hip shifts, breathing with those Pilates balls on the lower back. Again, this is pretty specific, those exercises, but I definitely start with a foundation of breathing and kind of work off of that, as opposed to kind of just getting right into it and just, aggressively attacking the stretching and then getting into the strength work. So for me, my warm up may take 15 minutes, right? Day to day, it changes, right? Some days I need to spend a little bit more time. Some days I don't. And again, that's just, for me, that's just how it gives you kind of insight on how your body, or how you're reacting to your outside world, right? Are you carrying a lot of stress into this workout? Did you go for, like, for me this weekend, I went on a long car ride, right? That usually bothers my back, things like that. So you can have these tools and you can use them at different times, and you can add in, you can spend more time on different things, different exercises, in order to kind of get you back to a comfortable baseline that allows you to work off of that and strengthen off of that. So for me, that, it might be a 10 to 20 minute warm up. And then from there, I'm into my strength work. And that being said, a lot of that strength work, I'm also working on, some postural stuff as I'm working through my strength work, right? So we might do like an RDL and do some 90-90s on the bench, right? Just to kind of hammer down that pelvis orientation with the ribs, but also get a strengthening exercise in order to get stronger and get the exercise in that I need in order to stay healthy. So I think the biggest thing is that it changes day to day, but I do think having these exercises give you an insight into kind of testing out and feeling out how you feel and how your body's responding in order to kind of adjust your workout going forward. That's what I would say.
One thing I want to add to Jacob, and you kind of alluded to this, right, is when a lot of people start to prep their body, or to, like, before their workout, right, what their warm up often looks like is stretching of hamstrings, glutes, calves, right, their extremities. Stretching is only going to get you so far if you're not mobilizing the foundation that it sits on, right? And we oftentimes will be in a very, like, frontal plane or sagittal plane while we're working out. And what we often try to incorporate into a lot of our prep work here is one, rotational movements, and moving the spine while you're moving that extremity, right? Because you want to be able to feel where that is supposed to be in space and time, because you're not always just going to be flat on your back and ask your extremities to move. You have to be able to mobilize and to feel your spine, your spinal segments, your lumbopelvic hip segments as you start to move those extremities out. So one thing, or a few things that we often incorporate, are a variety of ball work, right? It's not just a T-spine ball. It's not just a foam roller. Oftentimes we use kind of squishy gorgeous balls. We'll use small balls like this, for the foot, or for the the arm or the hand, the shoulder. We'll use larger therapy balls that have a little bit more give. We use a variety of things, and that is all meant to either aid in inhibition or activation of things, right? I always say you can't move what you can't feel, right? And so if you don't bring awareness to part of the spine or part of the shoulder blades, how are you going to move it from a functional loading perspective? So part of that is we live in such like a overstimulated, on the go, over sympathetic state. And so sometimes your warm up is meant to just allow for that breathing, like you were saying, and to tap into that parasympathetic state. And that's why we use some of the gorgeous balls, right? Because if you just the squishy balls, if you just start to dive in with these firm, dense balls, like into areas that are already like in this hyperspastic state or hypertonic state, it just puts you into this overdriven, like hyper aware of everything. And sometimes you just need to like deload that system and add a little bit different of a stimulus into that nervous system. And that can be really helpful for people when they're trying to get their breath work and trying to figure out, okay, what is this supposed to feel like? So when I go to load and move, you're getting a little bit different of a stimulus. The other thing too is that we try to train the spine to move, right? I think we're so afraid for so many people to not move our spine because we're afraid that we're going to hurt it, right? We're so afraid that we're going to throw out our back and we're, going to sneeze and we're not going to be able to walk for 3 days, right? Or 5 days or whatever the time frame is. If our spine was not meant to move, it would be a pole, right? But it's these individual vertebrae and individual segments. It's meant to rotate. It's meant to flex. It's meant to extend. It's meant to laterally flex. And so we can't be afraid of that. And oftentimes when we are afraid of it, that's when, these other sort of conditions and injuries will start to happen. And so that's really one thing that we took with Jakub's programming, was to be able to move the spine while you were asking the upper extremity or the hip to move at the same time. So we do, that wall one where you're kind of in like this rotational kind of reaching forward, but we're trying to get that rotation of the spine as well as activation of the core to kind of keep it on, in a safe position. But you need to have all of that, which can be exhausting sometimes when you're like, I just want to jump right into my workout, right? And you're like, okay, I have to spend that prep work sometimes in order to feel good during my movement pattern. So, I mean, to Jakub's point, you don't always need to spend 20 minutes on your workout or 20 minutes on your prep work. But there are times when like, that's all I'm going to do, right? I just need to do some mobility and do some activation stuff so that the rest of the day I feel okay. And then there were times when, I'm coming in hot and I'm just jumping right into it. And I kind of hope for the best with that.
And this is why we have members do different warm-ups. If they work with Jen, they work with us, we want to individualize that experience for them so they can get pain-free. And their warm-ups often look much different than what the small group is doing. But Jakub, any closing thoughts?
Yeah, I think just going off of that is, some days you might be doing 20 minutes of warm up. Some days you might not do much of a warm up. Some days you might just do that warm up. But it goes back to the point that I think doing something is always better than doing nothing. And that the more time you spend sitting, not moving, staying away from that pain is more time that, it's just building dysfunction. So keep moving and keep doing what you can is kind of the moral of the story, I think.
Jen, anything without going into an anatomy textbook or anything about fascia manipulation and making our brains tired?
I think when we're injured, we get scared to move that segment. And I kind of just alluded to that. And one of the best things that you can do, right? Because when you get afraid to move something, there's this innate response within your brain to say, okay, it almost catastrophizes that and can kind of perpetuate some of that pain cycle. And to Jakub's point, right? Like you have to, within reason, lay into it and start to accept a new load and a new change so that you can adapt that stimulus going into the brain saying, this doesn't have to suck or this doesn't have to be painful all the time. And so, it's really helpful when patients are open to, almost reprogramming that and feeling like just because they did something once doesn't mean that they're going to continue to be in pain or it's going to be a bad experience. And one thing that we did with Jakub too, to help change that was adding cups to the area, right? And so you just change that pain stimulus and change that input. You give tissue space to move and breathe a little bit. And then you ask them to load. And sometimes just doing that, you're doing the same movement pattern, but you're just adding a different sort of modality or stimulus to the brain. Sometimes can be really helpful and therapeutic as well.
All right. So, 22 minutes, we just covered pelvic ribcage approximation, diaphragmatic breathing, and spinal mechanics. So these episodes may start getting a little bit longer because I know for a fact you present on 8 hours of this stuff. So that was great, though. I appreciate that went fantastic. Jakub, you crushed it. Nice job. Jen, fantastic as always. Until next week, guys. This is fantastic. Thank you very much.
All right.